Hello, everyone. Welcome to Senior Health and Wellness Group Senior Spotlight. I am your host, Dr. Shawn Weiss, founder of the Senior Health and Wellness Group, where we actually provide educational resources, valuable trainings, and just helping guide older adults and their families and how to get through this journey of life with older parents. And the spotlight today, I am so thrilled and honored because we have an amazing guest. He's one of my new friends. And this topic, I think, is so important. And that is a topic of how do we, as children, help our parents navigate the journey of aging. And it can be very daunting. I've been a therapist for over 26 years. 20 of those I spent owning a licensed Medicare home health agency and helped thousands of people and their families get through the process and find ways to optimize health and longevity and helping people thrive. And it's tough. It's a daunting task. And many people are very confused. They don't know where to start. And let me tell you, a couple months ago, I came across a book. And I thought that this, by far, in my 26 years of practice, is the most well-written, structured guide to helping families and children navigate and help their parents to go through this journey that I had to find Barbara and I had to bring her on the show. So without further ado, I'd like to welcome Barbara Applegate to the Senior Spotlight today. She is not only the founder of Age Consultants, a senior care company in Arizona, but she is the author of this book. And the book is titled A Compassionate Journey, a definitive guide to providing effective, loving care for your aging parent. Barbara, welcome to Senior Spotlight today. Thank you so much for hopping on.
Thank you, Shawn. I appreciate being invited in. And more importantly, I'm thrilled at the fact that you and I can talk a little bit about this book and bring some of that information to your population.
Well, I'm so appreciative that you're here. And, Barbara, when we're in this world and we live it every day, and people don't realize, the statistics now are 2 out of every 5 Americans are kind of thrown into the role of caregiver, sometimes without warning, sometimes planned. But I find that I think the high majority of us are just very ill prepared for the whole thing. Do you find that to be true?
I do. It's kind of a sudden reality that, oh my goodness, there's some things that are happening with me and my relationship with my family and my parents that seem off center. And I need to know why that is and what do I need to do about it and who can I ask for help? And I do see very often that the first time that we make contact with a child of an aging parent, they are bewildered and concerned and a little nervous about something is going on and they don't know what it is and what to do about it.
And it's in this day and age too, and I would say especially even since COVID, there's just a level of anxiety on, again, just not knowing where to turn. I mean, we kind of have we're getting bombarded with lots of information and not knowing, can mom or dad stay at home? Do they need to go into a senior community? Can we bring caregivers into the home, or do they live in a different state and we can't find help for them? And it's daunting. And I agree with you. Just about every family member that I meet of patients that I've taken care of are experiencing that, whether or not their parent is still living alone in their own home or whether they've had to move into a senior community, whether that's independent living or assisted living. So what I love about the book, Barbara, is the way it's structured. And I thought, as I was reading, I'm like, oh my gosh, like if I didn't do what I did and I needed to help my parent, the structure of this book and how it takes you step by step, I think is so beneficial, and it makes it so much easier to understand the ins and outs. But what I do like is, where do you typically start with a client, Barbara? If you are taking care of somebody who maybe has just been in the hospital or maybe has had a sudden change and their ability to take care of themselves. Where do you start with
Well,
helping the family?
the first thing that we do in terms of being a part of a planning experience for the parent as well as for the uh, children is we ask the questions that need to be asked. What is it that brought you to me? What are you worried about? What are you seeing that isn't working the way it used to? And
Mm-hmm.
I think we need to make changes. I let them understand right away that if they're local, then it would be value to both them and their parent if I could do what I would call a visit in face-to-face visit so that I can get a sense of what's going on with your parent. If they're available to be a part of that, I would ask them to participate in introducing us to their parent. I would caution them not to try to answer any questions that I have for them because we are trying to get a full sense of what's going on with their mom and dad, or mom or dad. So we are
Mm-hmm.
trying right now in this first visit, is to understand why are you worried and where are your parents from your perspective functioning? What kinds of issues do you think I can help you with? If you don't know, that's not a problem. As long as you know that I am there to help you and I'd like to make a face-to-face contact whenever it's possible to meet your parent. That
I
first,
love that. It's
that
critical, that first visit.
it's critical. It's critical.
So that first visit it's critical to start establishing, because we're the first person, we've seen them for the first time, but the families know what changes they've seen. And, as a physical therapist, I'm all about wellness and prevention, right? I don't want to wait for something bad to happen. Sometimes we're brought into the situation because something bad has happened or they've had an injury or an illness. But I'm all about not waiting for something bad to happen. So, one of the things I love about the book is that it helps you prepare. It helps you look ahead to the challenges and knowing what you can do when that time comes. I think the preparation piece of it um, is just so well done. So I commend you on that because things are going to change, right? When we first meet somebody, that's gonna change as we see them. Maybe if they have some cognitive impairment, then you certainly are going to see some different changes. So setting up our clients for success is the huge piece, right? Of teaching the caregivers how to navigate as things change, right? It's not going to stay the same.
There's two very critical points that our first contacts make. First of all, the caregivers are no longer alone. And that's one of the most daunting experiences for a family member to experience. And that is, oh my, I'm in this on my own. And I feel like I'm going down possibly for the second and third time. And I know that I have to have help. The other part that's very critical for us to get actively involved as quickly as we can is, who is that elderly person? And what is it that they want? What is it that they need? How do we ascertain from our interaction with them what's really relevant to them? Because if we don't get their buy-in, no matter how good that information is, if they withdraw from any help, we're all dead in the water, so to speak. And the
Yep.
parent asked us to really tell me, meaning the parent, why are you here? What do you think you can do
What do
for
you
me?
need? What are your goals, right? What are you having the most trouble with and what can we be of help with? And we probably have a million stories with because it may not even be close to what the family wants, right?
Exactly. And if we can get their buy-in, if we can get the elderly person's buy-in, then I think we run the risk of being very successful in meeting both the family's needs as well as the elderly person. I just recently had a chance to talk with a large group of people, and we were talking about how do you collaborate with all the groups of people that are involved with your parent. And one of the things that I keep saying and will continue to say is you must bring that elderly person to the table of the group and let them hear what it is that each of these people can offer, but more importantly, letting these people, these professionals hear what that individual wants. What is their goal? What brings them the quality of life that they are striving for? We keep looking at our elderly as though this is stuff we've got to do for them.
Mm-hmm.
They're impaired in some way because obviously we've seen that they're having trouble managing. So we zoom in there and we want to take over and manage. What I would like for people to understand is that they're a part of a team of which their family member is a part of a team, but so is that elderly person. And everybody has to come together on a common goal. What is that common goal? And how do we then broadcast that to the support systems that your aging parent needs?
And you're
That
going
is,
to have the best outcomes
yeah,
when somebody is involved in the decision making, right? We want that elderly person to be involved in the decision making and the goal setting because that's when you're going to get the greatest outcomes and the best success and success that's sustainable,
yeah.
right?
Once they come to the table and they know, they look around and they know that these are people that want to hear them, what it is that they want to
Mm-hmm.
say. The part that we're really doing is we're building trust.
Yeah.
That elderly person is starting to get a sense of trust that whoever is there to help is there to help in a way that they feel they need the help.
Mm-hmm.
I'm an old social worker, so social workers learn from the get-go. You can never take a client and drag them to where you want them to be.
Never.
Never.
It's not going to happen.
You need to start where they're at. And so that's one of the first lessons we try to help the family understand
Mm-hmm.
is, yes, I know you've got a very strong awareness of what you want for your parent. Yes, you have a very strong knowledge base of what you see that's going wrong for them. But what you also need to do is know, what do they want from you? And the
Mm-hmm.
only way to find that out is by asking.
Mm-hmm.
And lots of times they say, oh, I don't need you to get involved. I'm perfectly fine. You just go live your life. I'd
Right.
never get my family. I'd never be a cumbersome burden to my family. I'm not their family. And so it's so much easier for them to open up and talk about what they would like for their last time in their last phases in their life.
Mm-hmm.
And it's surprising sometimes to hear. It's
Mm-hmm.
surprising for family to hear. Um, the beauty of doing this before there's a crisis is that then we can all get together with the elderly person and start building the plan.
Mm-hmm.
That plan is going to help avoid some crises, or God forbid, if there is a crisis, because so many people at
Yeah.
that age fall, and when they fall, they hurt
That
themselves
could change everything in an instant.
in an instant.
Everything could change in an instant.
But if we
Yeah.
could be ready at some level, know, and they know at some level, this isn't the end all now for them, but that there is
Mm-hmm.
hope for some remedy, then we all feel like we've been successful in working with that aging parent, starting with the family member. Now, we're not always as privileged to have all this done before the crisis,
Mm-hmm.
but that doesn't change the reality that you still need to work around that elderly person's goals and wants and
Yeah.
needs. They have to be actively
You
involved.
have to do that. They have to be, like you said, have a seat at the table. And I think, you address a lot of those things in the very first chapter of the book. And something else I noticed that I like, if I was a daughter sitting down with you and my parent for the first time, and I knew there were some changes, just being able to identify, or maybe I'm in denial that help is actually needed, right? What are some of those, red flag kind of situations where I mean, maybe it's a safety thing, right? Or what are some of those red flags, that you've come across where you're sitting down, you're like, okay, right away, I've noticed this, and you're trying to point out those red flags. What are some of those red flags, Barbara?
Well, for probably the most obvious is that their inability to plan their day-to-day care issues that they need on their own. The family is starting to notice medications aren't being taken. That's pretty
Mm-hmm.
critical. The family member wants to help with that, but the elderly person says, "Oh, I just know what to take from these bottles." And a family member says, "Well, as long as they know that, then they're okay." Well, you and I know that we don't even let professional caregivers coming in take medication from the bottle because it's so easy to lose count and to
Yep.
lose. So
Yep.
that's main issues that we look at when we're either talking with the family member or we're in the home visiting and asking the elderly person, "Would you please let me see how you manage your medicine?
Yeah.
Do you
Mm-hmm.
how do you know that you've taken it? What kind of systems do you have?" Most often they'll just say, "Well, I just have done
I
this
just
all."
know what to take. Yeah.
Yeah.
And
Uh,
that's so important. That's probably one of the biggest things, having the home health agency for over 20 years that we ran into was, on that first visit, seeing that there's clearly not a good system, or where maybe we've been brought in for one of those reasons, and they say, well, okay, mom is skipping, she's forgetting to take the medication, or not taking them at the appropriate time, or doubling up on them, and then it's a complete mess, and that is affecting things like fall risk, and that is affecting things like people that have heart conditions, people that have respiratory conditions that are not taking the medication properly. I think is probably one of the biggest red flags that we notice. And then, do you agree too? It's mobility and safety
oh
would
my,
be a huge one. If are they able to get up from all the surfaces in their home?
yeah,
They might tell you, I do, no, I do that by myself. Okay, well, let's see.
yeah, yeah,
They can say a lot of things,
yeah.
right?
But they have to really be able to do what they say. You
Mhm.
look around the house and there are telltale signs. The kitchen may not have been attended to for a long time. Dishes in the sink. Another thing that's very noteworthy is no dishes in the sink. No
There
dish.
you go. Oh my gosh, that's so true.
Where you look in the refrigerator and it's a refrigerator stocked full of foods that should probably be thrown away because most of it is expired, or the converse is nothing in the refrigerator. Uh,
Yeah,
Mostly in the freezer, but not freezer foods that are simple to prepare. So, those
good
are
point.
some of the telltale signs that we start looking at. Look at the laundry, look at the way in which the house itself is smelling. And
Hmm.
we do, I always ask, "Can I give you a hug when I first meet them?" And they say, "Well, yes," because they're very lonely in a lot of ways. And I'm
Yeah,
fabulous looking, I'm not
you are.
a threatening person. So I give them a hug, but I also give them a hug with a sniff test.
Yes,
And I can tell,
exactly.
and I don't say that to them, but I'm
Right.
looking at when did they last shower? When did they last change their clothing? Are they incontinent and are they walking around still having trouble getting that addressed?
Mhm.
So in that first interview, I'm looking at all those things, not to accuse them of anything, but for me to become educated
Right.
in what it is they need. If they tell me that, oh yeah, I have no problems taking care of my personal care, then, at some point I'll say, okay, well, how frequently can you do that? Do you feel you need to do that? Because we all know that as we age, we don't need to step in the shower every day. Our skin is going to dry out, but
Right.
we do know that there are some techniques to keep you fresh. What are you using to keep yourself fresh and free from running into UTIs? Which,
Yep. That's huge.
if you're running around with, an incontinent system that's not working, uh, how much water are you drinking? Can you show me how much water you're drinking? What are you taking it from? Oftentimes, oh, see this glass? I drink this glass. And I said, how often do you fill it? Well, 3, 4 times a day. Well, we know that's not true. We
Mm-hmm.
know that they should.
Yep.
And the other thing we ask them is, how do you get back and forth and get the food that you need? Who's preparing that for you?
Mm-hmm.
Is there a way in which you have food to replace? How do you shop? Who shops for you? How do you pay your bills? Are you paying your bills? We don't have to ask that question if when we go through their house and we see the telltale signs are none of these things are happening. There's bills.
Right. Very obvious.
Yeah, the cupboard is bare. There's no evidence of cooked food or even evidence of food being delivered. I don't have to insult them by saying,
Right.
you do all this. I just know that they can't. And so when
Yep.
we first visit, we want to make sure that the family understands. These are the barriers to safe quality care. These are the barriers that we all are going to have to, as a team, with your mom or dad or parents' involvement, come to some sort of a plan of care.
Mm-hmm. So, so speaking of that, Barbara, I feel like, when you're looking for those things, and like you said, and I love the fact that you're pointing out that it needs to be in a respectful way. Because there's things we just notice. We can do it with observation without necessarily having to ask verbally, right? And looking at the functional assessment, looking at medications, um, getting a general sense of what's going on. But there are other areas I feel I call them kind of pillars of health, right? That we're looking at. And your book addresses making sure not just with a functional assessment, that we are looking at are there signs of depression? Um, do they have socialization in their life? Are they are they having any behaviors? All of these things that we're looking at, that is that's taken care of part of the action plan, right? We are looking at all of those pillars.
Every last one of those quadrants are available for us that first visit.
Yeah. And I think that's why that visit is so critical. And it's so critical to have the right people there, right?
I
Yeah.
think so.
And when you're sitting there with a family, Barbara, I know that and me being in healthcare for over 26 years, and I have older parents as well now, and I'm an only child. So, and when you're so used to your parents just doing and doing, and then they do start having health issues, I've had to, stop myself and say, hey, wait a minute. Do I know where things are? Do I have the information I need to help them? So, could we talk a little bit about what do you recommend families start gathering in terms of you need to know this, this, and this. If you don't have it or don't know where to get it or where it is in the house, is it in the Bible? Where are certain things, right?
I think
What do you?
the first thing that we all need to understand is that there are documents called advanced directives, the medical power of attorney, the durable power of attorney, the mental health power of attorney, and the living will, not their will for their assets, their living will for choices and decisions about their body. Have any of these documents been discussed? Have any of these documents been identified that they know where they are? And are they a part of any of those documents? And I'll tell you the reason this is so critical, because if their parent has a crisis and cannot communicate what it is and who it is they want, then in most states, they run up against a surrogacy law based on who that state has identified as taking over. And that's generally a family member or a spouse or a live-in. But we have to make sure that those are the people that are adequately prepared to do that. And if the family member wants to be a part of it, they need to sit down with their parent and get that whole arena of documentation pulled together. Two ways to do that: go to an attorney. An attorney will help get all that together with your family member, with your elderly parent. If they've already done that, the attorney should have copies of that in case they haven't given them to you. The family members need to also make sure that they give those documents, the medical power of attorney, the living will, to their primary care healthcare people. They wind up in the hospital and they want to know what to do, and they're calling to say, okay, I'm the daughter and I want to take care of mom, tell me what's going on. And mom is able to communicate to them, but maybe not wisely anymore. They will want to know, do you have authority? Did your mother give you the authority on her behalf? That's your medical power of attorney. So if you're not going to get any other document put in place, get that put in place first.
Because it's the last thing you want to do in a crisis situation is try to start dealing with that then, which is why preparing in advance those items, it just makes it so much easier.
Yeah. And that is the very first things that we encourage family members to do. The other thing that I think is very critical, now you can gather all the medical information if you go to each of the doctors and you've got that little power tool, the medical power of attorney, and they can give you all of that information, but there are ways that you can get that information pulled together and in a system that may there be a crisis or not, you know what medications they're on and what the timing is. You know what doctors they're seeing and when their appointments need to be. You know what their diagnosis is, and if there's anything to be cautious about. You know how to care for your parent while they are needing some backup. And if you don't have those documents available, you can get them. Nobody's saying that they're impossible to get. With that medical power of attorney, you can get all of those from each of the doctors that they're working with, provided you know who those doctors are. So after you get your medical power of attorney, I'd sit down with them and I would make sure that I know every doctor that has provided care for your aging parent for the last 2 years. If they get that, and they also get permission from your parent, if they need that permission, to ask the physicians of record, would you please send me the most current up-to-date medication that you've got them on? Because that's another subtle barrier to good quality care. And that's each doctor wants to do a good job for their patient. They got a little tunnel vision, so they're taking care of
They do.
on their experience for that individual and their diagnoses and their specialty, but they don't always get all the information from their colleagues that are treating that patient.
They don't know what the other hand's doing, right? One hand doesn't know what the other hand's doing. I know that with technology nowadays too, and I've come across some very savvy seniors who do have their medical information on their my chart for their healthcare provider. And one of the things that I did was I had my mom and dad add me for access to that, which has been a godsend because I mean, even though I'm only an hour away from them, it's great for people who are further away. I know I can log in and get those lab test results or get, visit summaries, and I'm able to see, because my mom is going through cancer, I can see what her blood work is when she has those visits. I have access to those records. And I think that's something that it's really very simple to do for a child that wants to do that, is if the parent would give them access for a login, that they can get some of that stuff through the online charting system too.
I agree. I agree. But I do think they need to pull that information and understand that that information is going to need to go with that individual, that elderly person, no matter where they're going. If they're in the ER, if they're in the hospital, if they're going to a new physician, if they have that information pulled together in their hand.
Yep.
With
Have it
them,
written down. My mom has here's my medications. Here's the paper that has my medications, my doctor's names, their phone numbers, what their specialty is. And that's hard sometimes, especially if somebody is dealing with a lot of illnesses. They might have 3, 4, 5 specialists.
and most of us do.
Yeah. Yes.
Agers where that isn't the case, but for the majority of people, that's when, starting in their 60s, when they really start getting a little broader base of healthcare individuals actively involved with them. So it's to your advantage as the child of the aging parent to know who they are. The same with their financial people, and the same with their attorneys.
Yep.
There's no in their insurances. I've come into appointments and I'll say, okay, these are the things that we need, and here's how we can go about getting them. And then all of a sudden, this little aging person pops up and says, I think I bought an insurance plan for that. Well, where is it? And who knows about it? And who's your agent?
Yes.
Those are things that when they're caught up in their throes of crises, or when their aging process is starting to dull some of their memories of what they did do in order to protect themselves as they age, you want to have those documents in a situation where you have easy access to them. And I have a workbook that shows you where, what, and how to pull together.
Mm-hmm.
And where you put it is important. Keeping it updated is critical. But the important thing is you've got to have something to update. So
Yes.
that's the first partnership you're going to establish with your parents in you helping them with their health care, is their medical, their medication, their doctors, their diagnoses, their appointments. I would ask many aging parents, do you mind if somebody would go with you to see the doctor? Well, they just take over, is what I hear. And so I
Yeah.
caution people who are going to take them to the doctors, first of all, should be the primary caregiver, if that's possible. And
Mm-hmm.
that primary caregiver needs to be respectful to let that doctor and your aging parent communicate. If they forget to tell that doctor things, my strategy has always been to say, you know what, mom or dad, you were also talking to me about this. Do you think we should talk to Dr. So-and-so about what you've shared? And, oh yeah, I forgot. They're
Perfect way.
very important messages for that doctor to do his job well.
Mm-hmm.
I think all doctors, as you said, have a medical chart of some form. Either it's in my chart, or if they're not as up to date, it could really be, you've done a visit note, doctor, would you please give me a copy of that so I can
Mm-hmm.
start putting it together.
Yeah, absolutely.
Financial. everybody wants to be careful about the finances.
Mm-hmm.
That's kind of a private factor
Yep.
that especially this aging group has. You don't need to know how much money I have or where my money is and what I'm doing with my money. And yet we can see, the stack of bills
Right.
getting bigger and
Right.
bigger. And we say, well, who's managing your finances? Can I at least have somebody, a name, a phone number, and permission to talk to your banker, your
And oh my gosh, I get so worried about the scams with that too these days, Barbara. I mean, it's truly frightening. I had a patient this was many, many years ago before, all of the technology has come into play with these scammers who was paying his own bills, but the family started noticing that he was sending money to ABC charities or getting involved and things were coming in the mail and he was sending checks and paying close attention to those things if somebody is starting to have cognitive impairment to where they might not be able to decipher whether something is legitimate or not. And I'm always talking to families about making sure you're looking for those things, especially families or older adults that are actively using things like social media or who have a cell phone and are using an email. Because these scammers are getting very, very smart and very, very savvy. And, you've seen terrible stories of older adults losing their
everything.
money.
Yeah,
It's so scary.
yeah.
It
The
scares me.
family's not any aware that this is happening.
Yeah.
So I really think you do have to have that hard conversation with your
Mhm.
family. This is in today's world, it's chaotic. There's a lot of kinds of people who will touch you in some way. And I just want to know that I have the ability to protect you. And
And monitor.
the only way I can do that is if you will trust that I can be more clear about what is happening with your finances. Um,
Mhm.
Once they're burned once, they're very cautious. They won't trust anybody. And I
Right.
think that's a shame because when they're burned once, it's third degree burns. They're really
Yeah.
losing money. A
And
lot.
it's just so heartbreaking. Makes
Yeah.
you sick, doesn't it?
Yeah.
Barbara, I think, one, we could talk for hours. And we have the idea. And what I think we're going to definitely do is start dealing with, each chapter of your book in different episodes. And I think that's going to be so amazing. But I wanted to give the audience a sense of what is in this book and this guide for navigating and kind of give them an idea like, oh my gosh, this is exactly what I need to help go through this journey with my parents. And we talked about the beginning of just identifying how do you know if they need help? What are the questions that need answered? And then helping develop an action plan, involving that parent in decision making and goal setting, which is so important, and making sure you have the documents gathered of being prepared and not waiting for an emergency to try to handle all those things. But I wanted to give some chapter titles, and I think that would be really important for people to hear of what else is contained in the book. Other than developing the action plan and gathering the information, is what are the living arrangements and the safety involved with that? How do you navigate healthcare insurance? And good Lord, boy, that might take about 3 hours with the way health insurance is, and that is so daunting. It
Yeah.
is so daunting that between Medicare and the Medicare Advantage plans and the Medicaid that I've seen people in tears trying to deal with what was going on with the insurance. So that's such an important chapter. And you also talk about long-term care insurance and then dealing with terminal illnesses and grief, um, abuse protection involving, trying to protect your parents from predators and things, which we kind of touched on. And then also taking care of yourself as a caregiver. I recently did a webinar with the Ohio Department of Health on caregiver burnout. And
Oh,
that is so critical from an emotional wellness standpoint because of the stress. Like you said, we said in the beginning, 2 out of every 5 Americans are now in the role of caregiver. And if you're in the sandwich generation, you're raising your kids and you're also taking care of an older adult. And that is so stressful. It causes a great deal of anxiety. So you also touch on that in the book as well as giving amazing number of resources and evidence-based um, notations in the book. So again, the book is a compassionate journey, a definitive guide to providing effective, loving care for your aging parent. It's just such a good book, Barbara, and it's just going to help so many people help their parents navigate through some of these very challenging times that we're in. So I thank you so much for coming on today and giving us kind of a touch of what is in there. And you can totally tell when people are just caring and compassionate and truly have a gift for helping people. And I do feel that you're one of those people. So again, I really appreciate you being on with us today, and I hope you'll come back.
more than welcome to do that. And just my parting words are just remember you're not alone.
Absolutely. I love that. You're never alone.
Yeah,
And
yeah,
there's always a solution,
yeah, right.
right? And to be prepared. And Barbara, I know that you have a healthcare agency in Arizona, Age Consultants, correct? And
Yes.
I want to make sure everybody's linked to that too, because you do have some really great information on that website. So I'm going to make sure everybody has the link of where to find this book. And we can get that book on Amazon. And I suggest you run and grab it, because if you have a parent that you are worried about who is starting to have health issues or cognitive issues of any kind or safety issues, this guide is going to really put you and have a peace of mind. And I think that is huge as we try to prepare in advance, is having peace of mind that I know how I'm going to navigate when A and B and C arise. So thanks for writing the book, Barbara. I love it.
You
And I know we're going to talk again soon.
okay? Have a good
Thank
day.
you. Mhm.